Hello students. So today I will discuss about hemolytic anemia. Hemolytic anemia क्या होता है? In this type there is a reduced lifespan of erythrocyte. एरिथ्रोसाइट का जो लाइफ स्पैन होता है, जितना दिन वो टिकता है उससे कम हो जाता है, तो ये एनीमिया होता है. Anemia occurs when the rate of destruction of erythrocyte exceeds their rate of production. Okay, they are both genetic and acquired disorders. Accounts only for 5% of all animals. Genetic includes like sickle cell anemia, thalassemia, glucose 6 phosphate deficiency. Okay, acquired क्या होता है? Immune autoimmune hemolytic anemia, non-immune infections like parasitic, bacterial and drugs and chemical. Okay, autoimmune hemolytic anemia का होता है? Consists of warm autoimmune hemolytic anemia and cold hemolytic anemia, also known as cold agglutinin disease, mostly idiopathic, and acquired forms. Okay, it is frequently associated with other disease with an immunological components. Example: chronic lymphocytic leukemia, systemic lupus, erythro erythematosus, hepatitis B. Drugs associated are cyclosporin, levodopa, methyl-dopa, penicillin. Okay, sign and symptoms क्या है? Painful finger and toes with a purplish discoloration associated with a cold exposure. Okay, acute CID is associated with viral bacterial infection. ओके, तो नेक्स्ट हम बात करेंगे सिकल सेल एनीमिया क्या होता है. सिकल सेल एनीमिया क्या होता है? सिकल सेल एनीमिया, इट इज़ द hereditary condition. It is the disease in which your body produce abnormal shaped RBC. इसमें क्या होता है? RBC का शेप एबनॉर्मल होता है, नॉर्मल से अलग होता है. द सेल्स आर शेप्ड लाइक ए क्रिसेंट और सिकल. ओके, दिस सिकल शेप्ड RBC ब्रेक अपार्ट इजीली कॉजिंग एनीमिया. ये जल्दी टूट जाता है, वो जो ये कॉज होते हैं, मतलब ये सिकल सेल एनीमिया का कॉजेज होता है. दिस सेल्स ओनली लिव फॉर 10 to 20 days. ओके, इटियोलॉजी क्या है? SCA occurs when a person inherits two abnormal copies of hemoglobin gene on from each parent. A person with a single abnormal copy does not usually have symptoms known as sickle cell traits also as carrier, and these people do not have anemia. SCA is sickle cell anemia is caused by a genetic abnormality in the gene for hemoglobin, which results in the production of sickle's hemoglobin. When oxygen is released from sickle's hemoglobin, it sticks together and forms long rods which demand and change the shape of RBCs. तो पैथोफिजियोलॉजी क्या है यहाँ पर? मेम्ब्रेन ऑफ रेड सेल्स containing hemoglobin is damaged, which leads to intracellular dehydration. Okay, in condition when a patient's blood is oxygenated, polymerization of hemoglobin occurs, forming a semi-solid gel. This two process leads to the formation of crescent-shaped cell known as sickle cells. So these cells are less flexible than normal cells. Okay, the inflexibility leads to impaired blood flow through the microcirculation, resulting in local tissue hypoxia. Okay, so sign and symptoms, as you can see, pain can occur whenever anywhere in the body: anemia, chest pain, dysphonia, stroke, joint pain, arthritis, blockage of blood flow in the spleen or liver, fatigue, severe severe infection, anorexia, splenomegaly, infection of the long bones and larger joints, or an infection of a large organs, liver, lungs, brain में occurs. ओके, सो नेक्स्ट हम बात करेंगे थैलासीमिया. थैलासीमिया क्या होता है? ये भी एक एनीमिया होता है। एनीमिया क्या, ये भी एक डिवाइडेड है। दिस आर द ग्रुप ऑफ इनहेरिटेड autosomal receive recessive disease. These are the group of inherited autosomal recessive disease characterized by abnormal hemoglobin production, genetic disorder inherited from a person parent. मतलब ये एबनॉर्मल प्रोडक्शन करता है, ज़रूरत से ज़्यादा प्रोडक्शन करने से वजह से ये होता है। देयर आर टू मेन टाइप, अल्फ़ा थैलासीमिया या बीटा थैलासीमिया। इटियोलॉजी हम देखते हैं क्या है। In thalassemia, patients have defect in either alpha or beta globin chain causing production of abnormal RBC. Normally, the majority of adult hemoglobin is composed of 4 protein chains, 2 alpha and 2 beta globin chain arranged into a heterotramer. Okay. The thalassemia are classified according to which chain of hemoglobin molecule is affected. In alpha thalassemia, production of the alpha globin chain is affected, while a beta thalassemia, production of beta globin chains affected. Okay. Sign and symptoms क्या है? Iron overload. People with thalassemia can get an overload of iron in their bodies, either from disease itself or from frequent blood transfusions. ओके। सेकंड क्या है? बोन्स deformities as a result in abnormal bone structure, especially in the face and skull. So splenomegaly, sleep aids is fighting infection and filter unwanted materials such as old dormant blood cells. Okay. Slowed growth rates, puberty also may be declared in children. Heart problems such as chronic heart failure, okay, abnormal heart rhythms may also be associated with severe thalassemia. पैथोफिजियोलॉजी क्या है यहाँ पर? पैथोफिजियोलॉजी, इन बीटा थैलासीमिया देयर इज रिड्यूस्ड और एब्सेंट प्रोडक्शन ऑफ बीटा ग्लोबिन चेन। बीटा थैलासीमिया में क्या होता है? एब्सेंट, ओके, एब्सेंट होता है जो प्रोडक्शन ऑफ बीटा ग्लोबिन चेन का एब्सेंट होता है, यहाँ पर नहीं होता। दिस लीड्स टू relative excess of alpha chain which when unpaired becomes unstable and precipitate in the red cells precursor. Due to this, there is infective erythropoiesis. Okay, infective erythropoiesis. If mature cells reaches the circulation, will have a shortened lifespan. इन अल्फा थैलेसीमिया क्या होता है? डिफिशियंसी ऑफ अल्फा चेन लीड्स टू एन एक्सेस ऑफ आइदर अल्फा और बीटा चेन्स। डिफिशियंसी ऑफ अल्फा चेन्स लीड्स टू एन एक्सेस और आइदर अल्फा और बीटा चेन्स। दिस टाइम एरिथ्रोपोइसिस इज लेस affected, known as hemoglobin bursts or hemoglobin when in circulation and tends to precipitate as the cells grow older. This leads to shortened lifespan with the sleep trapping many of the cells. Hemoglobin is physiologically useless, functionless. Okay, glucose 6 phosphate dehydrogenase deficiency क्या होता है? It is also a hereditary disease. There are more than 300 different forms of glucose 6 phosphate dehydrogenase deficiency, only some of which causes anemia. Most common form G6PD deficiency is found in 15% of black Americans. It causes anemia when the individual is exposed to a trigger factor. Etiology क्या है? Foods, parabens in the hallmarks trigger for G6PD mutation. Okay, drugs, primaquine, chloroquine, sulfonamides, INH, and dapsone, nitrofurantoin, and high dose intravenous vitamin C injection. And थर्ड क्या है? स्ट्रेस फ्रॉम बैक्टीरियल और वायरल इन्फेक्शन. सो पैथोजेनेसिस क्या है? ये जो होता है ये इज एसेंशियल फॉर द प्रोडक्शन NADPH. ओके, NADPH इन एरिथ्रोसाइट्स, ये ज़रूरत होता है NADPH के प्रोडक्शन में. NADPA plus is a cofactor used in the anabolic reactions such as lipid nucleic acid synthesis, which require NADPH as a reducing agent. If there is deficiency of G6PD, this disease the production of NADPH, which is needed to keep glutathione in the reduced form. So this reduced glutathione helps erythrocytes deals with the oxidative stress. Hence, in G6PD deficiency, if erythrocytes are exposed to an oxidized agent, the cell membranes becomes damaged, the hemoglobin becomes oxidized and forms hinge bodies. साइन एंड सिम्टम्स क्या होता है? मोस्टली नो सिम्टम्स. ओके, मोस्टली नो सिम्टम्स, अभी तक कुछ नहीं मिला. फॉलोइंग ए स्पेसिफिक ट्रिगर: येलोइश स्किन, डार्क यूरिन, शॉर्टनेस ऑफ ब्रीथ एंड फीलिंग टायर्ड. तो आज पूरा हीमेटोलॉजिकल डिजीज पूरा ख़त्म हुआ. आई होप यू ऑल अंडरस्टैंड my video and also this PDF. As you can want, if you want, you can comment in the comment section for my PDF notes. I have PDF notes, I will send to you if you comment and want from me. Okay, thank you so much.